Good evening, guys. I'm just going to give people a minute or so to join us. Okay, I will start because of course you can always rewind back to the beginning at the very end. But tonight I'm going to be talking about how to get by with an injury when it starts to get really cold. So basically surviving winter with an injury. And the reason why I'm covering this topic tonight is because lots of my patients tend to come into clinic and say, I thought I was really doing well, and all of a sudden, my pain is much worse, and I don't know whether it's related to the weather. And as I say, there's lots of people that come in with this issue, and it's definitely something that's really common. And so don't think that you're alone in thinking that, and don't think that it's just in your head either, because there is definitely some theories as to why this is a real thing. So the main things I'm going to cover is why pain is worse in winter or in colder temperatures, what you can do to support yourself with your injury recovery, and some of these things will also be relevant regardless of whether it's cold or not. And then finally, just covering some supplements that people can take to support your body during winter, again, whether you've got an injury or not. Okay, so let's talk about the theories as to why pain is worse in winter. And as I say, this is a really, really common thing to believe. In fact, studies suggest that about 92% of people with pain, who've had pain for a very long time, will report symptoms of their pain getting worse when the weather gets colder. So there's a few theories as to why this might occur. One of them is that with the colder weather, the thickness of the fluid inside our joints, often called synovial fluid, literally gets thicker. So the joint feels stiffer because the fluid in there is a lot thicker and more viscous. And one way to kind of picture that is to, if you were to move your hand quite freely without, lots of friction and stiffness there, it's quite easy to do and quite pain-free. Whereas if you really, really tense your hand and then try and rotate your wrist, you can definitely feel how that's harder to move. It's not as smooth, it's a bit more rigid feeling. And that's kind of a similar feeling, I suppose, to how things might feel when it's colder and that joint fluid is a little bit thicker. Okay. Another theory is that with the colder temperatures, atmospheric pressure will drop, which means that the air around us is putting less pressure onto our skin, and that means that our tissue and the structures within our body can expand a little bit more. So if you're wondering why you've got more swelling, for example, despite it being colder, it's because that pressure is less on our skin, and therefore the tissues can expand a little bit more. And this expansion basically again creates a bit more pressure within the joints, which can in turn make nerves a bit more sensitive or allow more swelling. Okay. And then thirdly, when that lower pressure, when the pressure drops, our body literally produces more stress hormones. So your hormones like, I'm going to try and say this, adrenocorticotropic hormone and adrenaline, and these both stimulate chronic pain systems, and therefore we perceive that as higher pain levels. And then something else that's really important to, I suppose, touch on as well is mood. So of course, during the winter months when we've got shorter daylight hours, naturally we produce less happy hormones, so things like serotonin, and also with reduced sunlight we have increased levels of melatonin, and this hormone is something that makes us sleepy. So you might be feeling, that the nights are getting shorter, it's only 4:30, it's really dark outside and you're feeling really, really tired, and it's because your body is producing more of those sleepy hormones, less of those happy hormones. And naturally we start to feel a little bit lower in ourselves, maybe a little bit depressed, and And then thirdly, with the change in daylight time, our body clock is quite disrupted. So again, that just plays on our hormones and doesn't put us in the best place, especially if we've got an injury and pain. And then summing up all of that, again in winter, we generally just tend to be less active. It's cold outside, lots of us will drop our outdoor activities just because it's colder. And because we're less active, we're then not getting that fluid moving, we're not getting our blood going, and actually we're going to feel a bit colder. So that kind of brings us on to what you can do to try and support your injury. And again, these things are going to be whether you've got an injury or not, or whether you've got cold weather or not. Most of these things will help you and benefit you if you've got an injury. So things like warming up the area. So say if you've got a really painful knee, say often these symptoms are found in people who've had long-term pain. So something that's really common is osteoarthritis or arthritis. It's something that lots of people will have, and they'll have it for a long period of time. And these typically are your patients that will tend to feel discomfort with the colder months. So warming up the area, whether it be with like a wheat bag, something you can put in the microwave, rather than just using heat packs, because obviously these are reusable. These can be really helpful just to place on the area, and there's no kind of limit as to how long you can have that on for. You can kind of leave it on for as long as needed. Probably when the most helpful times will be first thing in the morning when things feel a bit stiffer, and then maybe just before you go to bed as well to help you get off to sleep. All right. Equally, hot baths and just wearing more clothing. Keep yourself warm, and that's definitely going to help keep that synovial fluid a little bit looser, not quite so thick, alongside just feeling a bit more cosy, and hopefully that improves your mood as well during winter months. And then the obvious, just keep really active, try and keep up with your rehab. And I suppose that goes back to saying, you don't have to do your exercise outside. If you're one of our patients, we will most definitely have given you something that you do not need to be outside for. And regardless, you can definitely be doing something inside to try and keep yourself active and moving. And thirdly, really, really important is hydration. So just because it's cold, our hydration needs don't change, but often we will tend to drink a lot less because it's cold and we don't want to drink water and that sort of thing. So yeah, just really, really making sure that you're still hydrating enough. And then again, just going back to mood, it's really, really important that you're kind of honest with yourself and checking in on your mentality. Are you aware of feelings of depression or anxiety, or just generally feeling low? Because it's often that identification of feelings like that that then lead you to act on them, whatever that might be. If you're maybe someone who's thinking, I don't think I'm depressed, but actually I would quite like to measure myself to see if I am, then there's a questionnaire that practitioners in hospitals will use, usually with stroke patients, but it can be with any patient really, to assess whether they are anxious or depressed and whether that might have an impact on their recovery. I will link it in the comments after the presentation, but it's something called the Hospital Anxiety and Depression Scale. It doesn't take very long to complete, but it might just help you in identifying whether you have feelings of anxiety or depression, and then again you can act on that, and hopefully have a positive impact on your injury recovery and generally your mental health. And then finally, just moving on to how you can supplement yourself in winter, and this is definitely regardless of whether you've got an injury or not. Starting off with probably the most obvious one and most talked about one is vitamin D, specifically D3. So 1 in 5 people in the UK will be deficient in vitamin D, and this is because we spend a lot of our time indoors. When we're outside, especially in the winter months, we tend to cover up our skin, and we can only absorb vitamin D3 from the sunlight directly through our skin. We can't get it through windows or anything like that. So it's not surprising that lots and lots of people do not get enough vitamin D3. Being deficient in vitamin D3 can again lead to feelings of depression, feeling a bit lower, that sort of thing. And supplementing or having the correct levels of vitamin D are really, really important for cognition, your immunity, bone health, general well-being. And there's also studies to suggest that supplementation of vitamin D can reduce the risk of cancer, heart disease, diabetes, and even recently more studies have come out to suggest that if you do supplement with vitamin D, then you have a lower risk of COVID and all of its associated complications. So lots and lots of benefits to supplement with vitamin D, and it's actually recommended that even if you aren't deficient in vitamin D, that during the winter months you should still be supplementing. So the current guidelines on how much vitamin D you should be supplementing with, and this applies to anyone over the age of 4 up until however 110, is 10 milligrams. So in international units, that's 400 international units, and often on the bottles you'll see both written, but 10 milligrams is what is recommended for people age 4 and up. Okay, and then moving on to the next supplement is vitamin C. So vitamin C, again, really, really important for your immune system and keeping that up and running. And really interestingly, there's some research to suggest that if you take vitamin C regularly, then you're less likely to have a cold that lasts for more days, so it can reduce the duration of how long you have a cold for. But of course, this only works if you're taking it regularly and before you get unwell. There's no point just having vitamin C when you're unwell to get its benefits. And interestingly, I'm going to note this because lots of our patients are kind of in an athletic population, is again, if athletes are taking vitamin C regularly, then it can actually help them prevent getting a cold by up to 50%. So yeah, no reason really not to supplement with vitamin C. Really, really important, especially when it comes to colds and offsetting it, or rather uplifting your immune system. And then thirdly, zinc also has been shown to reduce the duration of how long you have a cold for if you're taking it regularly. However, the recommended dose needed to do this is actually above the recommended daily amount, which is 40 milligrams a day. So if you are going to be supplementing with zinc, just be really, really careful that you're not taking over 100 milligrams a day. You can safely take up to this, but anything over this can cause things like headaches and nausea. And do be mindful that lots and lots of foods will already contain zinc. But going back to vitamin D and vitamin C, you cannot really overdose on these, but with zinc you do have to be careful of. And then finally, there is very, very little evidence to suggest that echinacea and probiotics might also support the immune system throughout the winter months, but studies on these are of low quality. They're saying that you won't do any harm by having echinacea or anything probiotic, and they will probably do something small to help. But in terms of supplementation, all of these should only really be done in addition to all the other things that you can do to try and keep yourself healthy. So good hand washing, like we've heard lots and lots about, hydrating, eating a really good healthy diet throughout, getting enough sleep, addressing your mental health, reducing stress if you can, and keeping up with your exercise. Okay, so quite short, but yeah, just really, really quick information on how to really, really try and supplement yourself throughout winter. Try and keep yourself moving. Again, try and keep up with your rehab if you are rehabbing with us. Keep moving. And if you do have any injuries or would like to discuss this further, then please do leave us a comment. Otherwise, if you'd like to get booked in to either see myself or one of my colleagues, then please do not hesitate to do so. I'll just take this opportunity as well to say that we are now offering some gift vouchers. So if you're struggling to find a Christmas present for someone, or if you know someone who would really benefit from some injury education and rehabilitation, then do get in contact about those as well. Okay, so thank you very much for listening, and if you've got any questions, pop them in the comments, and I'll also put all of the resources from today's talk in the comments as well. Okay, bye guys.